Okay. Good afternoon, everyone. I'm Jim Rooney. I'm President and CEO of the Greater Boston Chamber of Commerce. And on behalf of the entire Chamber team, we hope you're joining us feeling safe and healthy this afternoon. Maybe recovering from the trauma of watching last night's presidential debate and waking up this morning, at least in the Boston area, to high winds and rain. As I look out my window in downtown Boston, it's a really beautiful looking day outside, but certainly doesn't have the same feel of the hustle and bustle of employees working in our office buildings and walking around and going out to lunch. And while we know that it's imperative for us to practice good, healthy behavior for our region, and as we work our way through this COVID crisis, we're also anxious to get back to seeing each other and getting back to our work environments as well. And today's presentation is along those lines. We've done a lot of work talking to our members about the return to work and, how can employers think about making their workplace as comfortable and as safe feeling for their employees, and what kinds of issues are on their employees' minds. Certainly the commute, public transportation is on people's minds, childcare, and the opening of schools is on people's minds as it relates to returning to work. But so too is that feeling of safety and concern. So today's presentation focuses on that third issue, and it is by way of announcement a partnership with Project Beacon, whose mission is to provide affordable, timely, and accessible COVID-19 testing solutions. Our presenters today will offer ways in which the business community can think about protecting the health and safety of their employees through COVID-19 testing. Joining us today, we have Mansuri, Executive Director of Project Beacon, who has 35 years of experience in various research and development roles as a senior executive within the global biopharma industry. Muz began his career in the pharmaceutical industry as a bench medicinal chemist and worked his way up to serve as the chief executive officer of several biotech companies. So welcome, Muz. Alongside Muz is Kevin Chu, head of enterprise business development at Project Beacon. Kevin is also a senior associate on the healthcare team at F Prime Capita, where he invests across the healthcare subsectors and helps manage the funds existing in new investment efforts in China. Kevin and Muz, we're grateful to have you with us today. Before I pass it over for your presentation, I want to remind our attendees to submit their questions through the Q&A feature at the bottom of your screen. We're also recording today's event, and it'll be accessible to everyone on our YouTube page shortly after the event. So with that, let's go ahead and hear from today's guest, and I'll turn it over to Kevin and Muz.
Thanks so much, Jim. Can you hear me? You can, I hope.
Yep.
Yes, good. Thank you so much. Thank you, everybody, for making the time. We're pleased to be here, and I'm sure you have a bunch of questions, and we'll go through that. We're going to talk for about 20, 25 minutes, and that will leave, I think, hopefully enough time for lots of questions. And if you have more questions afterwards, I'm sure we can find some way for you to reach out to us. We're going to, as I said, talk a bit about testing. And we'll go through some slides that Kevin and I will talk about, take turns in talking about. I want to say at the beginning that there are no right or wrong answers in this, right? I mean, everybody will have to look at what they need for their particular organization, what they can afford, what they're comfortable with, and it will vary from company to company. So I think we can help you think about that a bit, but also think about how do we help you get tests. We'll talk about a bit about this in a second as we go through it. But the other thing I would like to point out, it doesn't really matter what size you are. We will try and find a solution for you, either with a site that's directed for your individual employees or a site that we can share where you can go on and have your tests. So if you go to the next slide. There we go. So this will be in 3 sections really, which is why testing and how do we test, which Kevin will talk about mainly. I'm going to talk a bit about who we are and what we offer and why we've taken the direction that we have. And then we'll we'll turn it over to as long as we can for the Q&A and the discussion piece, because I think that's the really way we're going to get comfortable. And I think any back to work strategy in this day and age under COVID, I think does require some decision to be made on testing. You can decide not to test, or you can decide to test with what frequency, but I think an active decision is required, and we hope we can help with that. So with that, Kevin, I'll turn it over to you.
Thank you, Muzz. Hi, everyone. So maybe we could go to the next slide. So I have a couple of slides here that just kind of speak to return to work strategy more broadly and how testing fits into it. So maybe just a statement of kind of where we are. So I think, as everyone knows, this pandemic is not going anywhere anytime soon. I think globally we're at 37 million cases confirmed worldwide. The US has clearly been hardest hit with 7 million cases and upwards of 200,000 deaths. And there's no definitive signs of that slowing down anytime soon. Even in a world where the vaccines become available, let's say by the end of the year, there are critical hurdles such as the efficacy of those vaccines, the manufacturing at scale of those vaccines, and also importantly, the mass distribution and the logistics associated with that, all of which translate to meaning that it'll probably be some time until we as a society are able to achieve broader community protection, or what you've probably heard of in the news as referred to as herd immunity. So in this context, return to work strategy should really consist of a multi-pronged approach to guarantee the safe environment of your employees who are returning to work. Consistently, what we've seen in the employment sector is a couple of strategies. So first and foremost, increasing hygiene protocols. So routine cleaning and disinfecting of surfaces and equipment and points of contact, promotion of frequent and thorough hand washing, making accessible and setting up sanitation stations all throughout the office, really to increase the frequency of sanitation. Also importantly, limitation of person-to-person interactions. So, where it's possible, implementing working shifts such that you're minimizing the number of employees that are on site at any one time. And where that's not possible, at least trying to promote and enforce social distancing protocols. And in some cases, even installing physical barriers, especially in certain types of work where you're in constant contact with customers or other employees. Importantly, the use of PPE is strongly recommended and has been the case for some time, especially by the CDC and others. I think most frequently in the workforce, we're seeing masks, eye protection as being kind of the primary form of protection there. But importantly, and the kind of the core focus of today's webinar is really to talk about testing as a critical part of that. And the reason why testing is critical is because it's the only way that you can ensure early identification of an infected individual, which becomes critical to trigger an entire cascade of downstream actions, such as quarantining that individual, and then implementing contact tracing, right? And all of that is critical for preventing and containing an outbreak. Given the fact that it's been well documented by the scientific community and researchers that infected individuals can actually go several days without symptoms, the only way to ensure that you're catching the virus early on in pre-symptomatic patients is to routinely test and have a testing program in place. So let's go on to the next slide. So, beyond the obvious, I think implementation of a routine test program also has several additional key benefits. So first and foremost, it allows you to project confidence to your customers, especially for those businesses that rely on frequent in-person interactions with customers, such as banks, retailers, grocers, just to name a few. In addition to that, by sponsoring a routine testing program, you're also giving your employees the peace of mind that his or her work environment is safe. And that goes a long way to reducing stress and anxiety and ensuring general mental wellness of your employees. Importantly, prevention of outbreak within your employee population is critical for ensuring or preventing the potential broader outbreak in the larger community, right? And it really starts at the local level. And as we know, these infections can travel very quickly And so starting locally is critical to preventing broader outbreak. And all of this is important for ensuring that we as a society maintain a course on this path to broader economic recovery. And we think it really starts with testing. Move on to the next slide. So there are a couple of critical considerations that should go into figuring out what is the right testing solution or right testing program for my organization. The important factors include, for example, the nature of the work, right, or the characteristics of the work. So for example, how many employees you actually need to have in the office at one time versus remote. How closely these employees need to be interacting with each other, which would inform, the potential kind of risk levels of contact. In addition, the fundamental demographics of your employee population are also very important. So for instance, higher risk, if your employee force is higher risk, and the risk factors there being age, and comorbidities, and several other factors. Also important are socioeconomic factors, so which might influence decisions like how they're commuting to work. And all of these things need to go into factoring into what is the right strategy for me. I think importantly, the ability to keep employees remote versus not, it comes into a critical consideration. I think what we recognize is for a lot of businesses, whether that be retail, manufacturing, R&D, you don't have a choice but to have employees back at work. And so for those populations, testing becomes ever so critical. Go on to the next slide. So ultimately, testing is a risk mitigation strategy, and it should be influenced by factors such as the epidemiology of the infection. So more broadly, kind of the local community positivity rates that we're seeing, which as we know can fluctuate from time to time. And also things like the cost of sponsoring a routine testing organization, testing program. Some employers or some businesses may be less cost sensitive, whereas some might be more cost sensitive. And so all of those things need to be factored into the program design. And importantly, there's also logistical considerations that need to be factored as well. Based on the employee population's risk profile, the employer's risk appetite, the testing scope can really vary, and we've seen this as the case across employers. Based on the portion of employees who are identified to be high risk, just starting on testing just those who are high risk. So, for instance, those who have been identified as contacts, or those who are exhibiting symptoms, and just testing those, to maybe more broadly testing employee cohorts who are, let's say, more predisposed to frequent interpersonal interaction. So again, sales force, retail, what have you. And also more broadly for those organizations that are more risk averse or want to ensure kind of the maximum protection, testing everyone, right, at all offices. And so we've really seen a spectrum. And again, there's no right answer. And it really comes down to what your risk appetite is, and also importantly, what your employee population risk profile is. We recognize that every organization is unique, and so the benefits and so the program design needs to be unique as well. But I think what is universally true is that all of these considerations should be thought about, should be thought through as an employee organization. And that the benefits of a routine testing program are probably going to be there in some level for every organization. So move on to the next slide. So I think the next section, we're going to talk a little bit more about Project Beacon and how we've been doing testing. And I'll turn it over to my colleague Muzz to take us through a couple of the slides here. Oh, Muzz, you're on mute.
Sorry, I'm unmuted, right? This is the most common thing I hear on Zoom is you're on mute. So we've talked a bit about how to test and why testing. Then we'll talk a bit about Beacon and how we might be able to help and work with you. So the next slide, please. So Beacon is a civically minded effort with no profit motive. We were created to help the Commonwealth to test, and we're a partnership between the Broad Institute, which is in Cambridge, Google Ventures or GV, and F Prime Capital, which is the venture arm of Fidelity. And we were based on the idea of how do we get people back to work and how do we get people back to school. So what we're focused on, as Jim said at the beginning, is to try and provide the lowest cost test that we can to you, to employers, and a number of other what we call use cases, which is to schools and to vulnerable populations. But we're not going to talk about that today. We're going to talk a bit about employers. And as we think about employers, I think we need to have 4 things that we think about. One is, and I'm not going to take these in order, but one is scale. So can we actually test at the right scale to be able to help all the people on the call and as many employees as we can in Massachusetts? So at the moment, we're working exclusively with the Broad, but we're hoping to find other testers. But at the moment, all our tests are run with the Broad in Cambridge. And the Broad's capacity is at peak. It's not there yet, but it's at peak, going to be about 100 to 110,000 tests a day. So the Broad so far, you can look it up on their website, have run about 2.2 million tests. And they run daily between 35 or 30 and 70,000 tests a day. At the high end, it's about 65, 67. And when they run the 67,000 tests a day, it's an incredible achievement and they should be lauded and praised for it. What's both depressing and praiseworthy is that they are running the 65 to 67,000 tests a day. And that represents about 12% of the testing capacity in the nation on that day. So that's amazing that they can do that. So clearly we have a scalable test. For those of you who want to know the kind of test, this is, and Kevin will show this at the end, but this is a front of nose dry swab. So it's a Q-tip. You just swirl around your nose 2 or 3 times, and then it's sent to the Broad, and it's an RT-PCR test, which is the gold standard of tests. And it's the test that people use most often to confirm tests. So if you remember the Mike DeWine thing, when the president went to Ohio, DeWine was tested as positive early in the day and then negative at the end of the day. At the beginning of the day, he had a point of care test, which was then confirmed with the RT-PCR test. So we're running a scalable RT-PCR test. The second thing is it fast and reliable? And again, you can look on the Broad website, they'll show you, but I think the average Broad turnaround time is something like 17 to 18 hours. So we will pick it up. We have a number of sites around the city. We pick it up by 5 p.m. and people have their result back on their iPhone or whatever you need to log in within the 24-hour period. So 99% of people get their answer within the 24-hour period. And again, we can follow that and track that. In terms of cost, it depends a lot on what we want to do for you. So when you think about a test, there are 3 things that you need in that test. One is the test itself, which is how do I do my RT-PCR? The second is getting the sample from the end of your nose or the end of your employee's nose to the Broad. And so obviously, how do we do that? How do we fulfill all the obligations, the HIPAA requirements, the medical requirements, the state requirements to do all that? So there's the logistics of getting the sample from the individual to the Broad. And the third piece is the technology that goes on the front end, which makes sure that you register, you get the right QR code, you get that code is followed all the way through. And then, that once it's followed, you get notified if it's positive or negative. And in the event it's a positive, we have to let the state know or let the Commonwealth know. And then there'll be follow-up questions, et cetera, et cetera. So those 3 things must all be done. And so it's those 3 things, begin at around $40 for the test, and then we add in a modular way, whatever else you need will go on top of that. And in terms of tailored solutions, as I said, it depends a bit on exactly what you're looking for. Do you want it done once a week, twice a week? The other point I forgot to mention, the beauty of a 24-hour turnaround, obviously, is if you are positive, we can do quickly the contact tracing to be able to follow who you met in the last 24, 36, 72 hours. Obviously, the longer the delay in getting you the result, the more difficult or the more problematic or the larger the scale of the problem. And when you do the contact tracing. So the tailored solution will be both in terms of frequency and then how do we work with you to do that. Next slide, please. So this we talk about end-to-end solutions. Kevin talked a bit about understanding your testing strategies. I want to talk a bit about items 2 and 4 here, really, which is how do we, based on your key drivers, work out what the appropriate testing regimen is with you, and then trying to find a solution. And the 4th piece, which is how do we operationalize that? How do we work with you to work out the logistics to get the sample from your employee to the Broad and get the sample back? Now, we've been focused, because we have the Broad to do the testing, we've been focused entirely on the logistics, which is the transport of the sample from the employee to the Broad and the technology front end. And we don't have time to go through it today, but if you wanted to at the right time, we can show you how we do it. But we can set up the technology such that your employee can schedule it. They'll go to some testing facility that we help set up. They can be in and out in 3 minutes, roughly 3 to 5 minutes, and they can enter all the information on the technology, on the IT system, that it does it all before he or she arrives. They have the sample, then they leave, and then they will be informed on their iPhone or by text message or by email or whatever method you to choose. So we've been focused, as I said, on the logistics and the technology, and we will work with you to make sure we can do what you need to get the test to the Broad. So those are the things. So Kevin, do you want to finish it, take it home from here?
Absolutely. Thanks, Muzz. So we go on to the next slide. So just double click into what Muzz already talked about. Our current testing offering involves what we call a professionally administered or observed specimen collection operation, which is essentially where we set up a physical centralized specimen collection facility. We staff it with healthcare professionals who've been trained on how to do the specimen collection. And then your employees just show up at that designated site to get their specimens collected. We then, on the back end, transport those specimens to the lab for processing, and the lab results are pushed out to your employees digitally as soon as they're processed. And typically all of that is done within 24 hours. For larger employers, and usually we define that as employers with maybe 100+ employees back at work at any given day, we have been able to set up dedicated private sites, whether that be in a conference room or in a parking lot for those larger employees. And we've done that a couple times for large employers in Boston, Cambridge. For smaller employers, I think our approach to date, and also our approach moving forward, is to set up what we call shared sites, which are dedicated specimen collection sites, conveniently and centrally located in an area where there are a lot of employers, right, kind of an employer hub, and such that it's reasonably close for those employers to send their employees to that site. We currently have one of those sites up and running. It is in Kendall Square at the corner of 2nd and Binney. And then we are in the process of launching, kind of replicating that model to a number of different sites throughout Massachusetts. So just to name a few: Seaport, Alewife, Waltham, Watertown are the ones that we're actively working on. And I think our goal is to be able to replicate this wherever hubs of demand exist. So importantly, we are also actively working on what we call kind of a next generation offering, which would enable us to offer a more decentralized specimen collection process, whereby the test subjects will be allowed to swab themselves without the supervision of a trained healthcare professional. We're still in the process of finalizing the design of this offering, and part of the rate limiting factor is a emergency use authorization that we're expecting to come through from the FDA in the coming weeks. But our plan is, as soon as we get that we'll be rolling that out. The cost of our current offering, again, the administered or observed testing offering, ranges from $60 to $90 per test. Again, as Muzz mentioned, really depends on the scope of the services involved in the program, right? So the infrastructure, the staffing, et cetera. And generally, the shared sites, just given the fact that it's a single infrastructure, single set of staff that we can serve many people with, the shared sites will be cheaper on the lower end of that range. As we moved into self-administered unobserved testing, we believe that the cost of the testing will drop further to that $40 to $60 range, just given the fact that we won't need to staff professionally trained swabbers and observers. And so that cuts out a lot of the cost. And since we have no profit motive as an organization, all of the cost savings that we realize as we continue to refine these offerings, we intend to pass back to our consumers. And so we believe that by making testing more affordable in the long run, we will, in effect, be furthering our mission of expanding testing access more broadly to those who need it, and not just those who can currently afford it. So maybe we can go on to the next slide. So I think Muzz already alluded to this, but it's important to distinguish that our specimen collection method is what we call a front of the nose swab. So not the back of the throat nasopharyngeal swab that was part of the first wave of testing. So this front of the nose, much more simple, much more comfortable, and usually the swabbing process itself is less than 30 seconds. Once the specimen is collected, it's transferred to our lab partner, the Broad Institute, where it's processed as an RT-PCR assay. And as Muzz mentioned, RT-PCR is absolutely kind of the gold standard as far as diagnostic test assays go. It's just much more sensitive at picking up low levels of virus compared to some of the other modalities that you may have heard of, like antigen testing. And Muzz already covered what the Broad has done, but I think the point being, they've absolutely become kind of a major tester in not just in the state of Massachusetts, but in the nation. And so they've gotten very good at this. And importantly, they've designed their lab infrastructure and process to ensure a 24-hour or less turnaround. And consistently, they've been able to deliver on that. Next slide. So designing the right testing program is, might not seem like it on the surface, but it's actually a relatively nuanced exercise and involves a number of different steps. There are the steps associated with the one-time infrastructure setup. There's also a number of steps that may or may not need to be customized associated with the daily operations. I think the point of this is just, we now at this point, with several months of operating experience under our belts and several customers, that we've been able to learn from, we've gotten pretty good at this. And our goal is to partner with companies like yours to ensure that we're able to help you develop the right program and implement the right program to help meet your needs and your employees' needs. So I think with that, if we go to the next slide, I think with that, that wraps up our what we have prepared as materials for the presentation. And maybe I'll turn it back to Jim to help us moderate the Q&A.
That's great, Kevin and Muzz. Thank you so much for all that information, and certainly stimulated questions in my mind. And I would encourage our audience to use the Q&A feature at the bottom of the screen to add their questions. But I'll kick it off, maybe, Kevin, a little bit on some of your last points about, you mentioned some existing customers. I know that you've been helping universities and colleges with bringing students back. I don't know the degree to which you can reveal who they are, but maybe you can talk generically about that experience in this program and how you're supporting colleges, universities, and existing businesses, even if you can't name them, maybe generically, what kind of industries and how you're doing it.
Muzz, you're on mute. Did you want to take that?
Let me take that. I'll take that, and maybe you can add something. So, Jim, one is, we think about 4 use cases. Vulnerable populations, which is assisted living facilities, skilled nursing facilities, group homes. One is universities, one is schools, and then the last one is employers. I think we have been working with universities. We have a couple that we work with, depending on what they need. In some universities just want pick up and drop off because they have their own nurses. There's no need for Beacon to be involved in that, so we haven't done that. But if universities want skilled nursing facilities on site, we've been able to do skilled nurses on site. We've been able to provide that, so we've done that. With nursing, with vulnerable populations, we are providing both nurses and doing picking up and dropping things off, and helping them collect samples. So we've started doing that. There was a question, are we working with federal, state, and local governments? We are working with the state to try and find if we can help some with some of their vulnerable populations and some of their school testing.
Great. A couple of questions in the queue here. So for companies that choose to self-administer on site,
Yes.
Are they then responsible for the transport, physically bringing test results to the lab, or how does that work?
If you're prepared to collect the sample on site, we are prepared to arrange for it to be picked up, and using the technology that we talked about that we've developed, it will all come to your employee in the way we'd expect. So we can work with you to find that solution that happens, that works best for you. So I think that's what I would say to that one, Jim.
Yeah, I think this next question goes into the HIPAA sensitivity that I know one of you mentioned.
Yes.
It's about, the employee medical data and, that confidentiality and reporting results. You mentioned, I think, Muzz, that requirement of reporting to the state. Any others? Do you deliver the results to, or can the employee choose to deliver the results to their PCP, or how does that all work?
Are you still there?
Muzz, did we lose you? Oh, I think you're back.
I'm sorry, I'm still here. You lost the question. I'm back. Sorry, yes.
Did you get that question?
I did not, but Kevin got it, so Kevin can answer.
Yeah. So our technology has been set up with HIPAA compliance in mind and security in mind, recognizing that we are handling pretty sensitive information. Currently, what is required of us, and this is more for a state reporting, from a state reporting perspective, what is required from us is that we are sharing important demographic information from any test subject to the lab, and then that the lab is sharing that with the state, right? And so that is part of a kind of a state mandate to be able to capture that information. It's just simple demographic information like name, date of birth, sex, contact address, and all that, plus the test result is transferred to the state almost instantaneously, and that connection is set up through the lab. And it's really to facilitate the state's contact tracing efforts. Now, on top of that, so what we've commonly gotten in our conversations with employers is, especially as certain employers are thinking about implementing testing as a mandatory requirement in order to gain access to a building, right? That's kind of on the extreme of risk mitigation, but we have seen that. So in those situations, it's important for the employer, the administrator, to be able to view the test results. And so we've built that into our process. And essentially what that requires is an employee essentially signing an informed consent that allows us as a third party to release the individualized results to the employer specifically. So we've kind of built that into the process, and all of that is done in a HIPAA-compliant fashion.
Okay, so it sounds like
we recommend, sorry, Jim, we recommend that employers ask the employee to sign the piece of paper because they're paying for the test, and then we can allow you to do it. If it's a positive, we actually have to tell the state, and the state will do the contact tracing. So people will know de facto what's going on if there's a positive.
Okay. So as you think about, or as organizations think about sort of considering this opportunity, what is there criteria? Are there minimum numbers of employees or volume requirements to make this all make sense? Or what other criteria might there be as you think about a potential employer that might consider this?
So 2 or 3 things. One is, if it's an individual site that you want set up for your organization, obviously at that point we would think about a minimum, because we have to be able to, it has to be the lemon has to be worth the squeeze. What we will do is work with you to man the site or to support the site in a way that works. So, depending on the volume, we might do it Monday, Wednesday, Friday, Monday through Wednesday, depending what you want. Obviously, we'd like the site to be as full as possible, because obviously that makes the things work the best. If it's a shared site, I don't know, Kevin, that we have a minimum. I think because you just sign up, and what you will do is you'll get access to the portal, and you'll make the appointment in the way that you can, and you schedule it, you turn up. And so that's the beauty of the shared site strategy, because it does allow smaller organizations to take advantage of it when they can't afford the major individual site that they need. So on the shared site, there's no minimum necessarily, But obviously, if there's an individual site, there will be a minimum.
That's exactly right, Maz. And I think our goal is to set up as many shared sites as there can be sufficient demand to support. And the idea there is, we can be really agnostic with regards to, volume requirements and kind of the size of the employer. So long as you have access to the web or a mobile device, you can register, schedule, and send your employees to our sites.
The one thing we are finding, Jim, which might be interesting to your members, is that when we ask the individual companies, how many tests do you think you need? They're overestimating by probably a factor of 2. So,
Okay.
Somebody says, I think I'm going to need 100 tests a day. What we're finding is probably 40 to 50 people actually do it.
Yeah.
So when you think about your individual employees, they're going to say yes, but the number of people that take it up is probably 50%. And the ramp is slower than you think, because there's a whole psychological issue about coming back to work and all that kind of stuff.
Yeah. So I don't know if you make recommendations or you just sort of gauge what people's degree of, I guess, sensitivity is, but what's the norm in terms of test frequency? Is it once a week, twice a week?
It's normally once a week. Some people do twice a week until they get to some kind of plateau with some kind of, history there, Jim. So it's between once and twice a week.
Yeah, okay. Question about the self-administered testing options and how far out, I know that, I think, Kevin, you mentioned that that's kind of an in-development thing. What's the time horizon, you think?
I would think it's a matter of weeks, days to weeks, Jimmy. What that does, let's be very clear. We're waiting on the BRO to get their EUA, or Emergency Use Authorization, from the FDA. Once that's done, then we can go forward. So it's all dependent on the FDA approving it and then rolling it out after that. But I think it's low digits. I would imagine.
And do you, I would imagine you continue to evaluate new testing methodologies. There's a question, for example, about a saliva-based testing that has some high degree of accuracy, maybe easier, and make employees feel more comfortable.
It's always
are you just what you described, it sounds like, is the current methodology, but over time you'll embrace what you feel is appropriate?
So the sample collection methodology, Jim, so there are 2 or 3 things that are coming on that we're keeping an eye on. One is saliva versus front of nose. Clearly, it's hard to get a young kid to stand still and put a cotton swab up his nose and without him running off. So in that kind of use case, clearly a saliva test would be better. The BRO does not do saliva tests at the moment, so we're looking for other people to do that, and we have a couple of ideas in place to do that. The other thing that we're looking at that your members might be interested in is pooling of samples, and that becomes easier, obviously, under certain circumstances, which again would help drive the price down. We need, we obviously want to keep driving the price down as much as we can, and so that's going to be interesting. And the third technology, obviously, that we are looking at is what they call point of care testing, which is where you take a different kind of sample. It's not an RT-PCR test, and then you do it that way. So all these things are being evaluated, and we'll drive them forward as much as we can.
Yeah. So,
sorry, Jim, the last point, I didn't mean to interrupt you. The key thing is to maintain the robustness of the turnaround time.
Okay, yeah. So as you think about an employer whose motivation is to make people feel safe, comfortable, and all the good reasons for doing this that you both mentioned, I can foresee the circumstance where it gets set up and someone tests positive. Now you've got the rest of the workforce that's nervous. Do you support the employer in how to deal with that with the remaining workforce?
So I'm going to answer that, and then Kevin will talk a bit about supporting the employee afterwards, if you would. But so there are 2 things. What we've been talking about, Jim, is purely asymptomatic testing, right? Surveillance testing, where we're looking at the vast majority of people, or the vast majority, 99% of people are going to be negative, right? So clearly in that kind of thing, we need not only, we need to decide, what happens if the positive comes back, and how do we support that individual, but the other thing is, how do then we go into some kind of surge mode where we test all the contact tracing that we have. So we need to come up with a solution to both. And we've done that. But Kevin, you want to deal with that question?
Yeah, and I was just going to say, so I think, in our experience, all of the companies that are thinking about implementing a testing strategy are in parallel thinking about things that Mazen mentioned. So contact tracing solutions, and also follow-up care solutions. I think where an existing employer has, let's say, a primary care benefit that they already subscribe to, or let's say occupational health, services that are already being kind of sponsored, then what we do is we allow that that communication between our results and those service providers, just so that everything is communicating and in sync. I think in addition, for those employers that don't have that in place, we have connections to all of these service providers, and also based on just kind of our interactions with other employers who have done the diligence to evaluate all of the various providers, we're able to give you at least what we've been able to observe and what we've heard from our customers as a review of which of the service providers might be offering this versus that, and what some of the trade-offs there might be.
Yeah.
The state will call you automatically, Jim, if you're positive.
Yeah. So, I mean, it sounds like there's a lot of tailoring to the special needs of the employer, but also beyond whatever services that may not be specific to testing, like this support employee, that, you have relationships that you could make available to the employer should they need it. I mean, it feels like that question got more into the HR management area than specifically medical.
Well, HR has to be keenly involved with this, Jim.
Yeah.
They have to, because they're going to, we've had, sorry, I didn't mean to interrupt, but we've had groups who have reached out to their employee base and saying, if we do this, how many of you want to take it up, et cetera, et cetera. So
yeah,
different companies are doing different things.
Yeah. Question about sort of the mission of Project Beacon. We've talked a lot about making testing available, but question about public policy advocacy around rapid testing becoming readily available for all. Are you in that space at all, or are you in a service kind of
There are lots of people who are advocating for testing. I think we've started, we're mainly focused on actually doing the logistics, Jim, and getting that done especially for the use cases like vulnerable population schools and people who can't afford it. So I think there are plenty of other people advocating. We have not got ourselves involved in that.
Yeah. Okay. Yeah, we're among them. So
exactly. You'll do it better than we will.
We'll handle. So as I'm listening, it sounds like what you described as these shared testing facilities is something, as you roll them out, we could make available to the clusters of businesses that we know. For example, Kevin, you mentioned the seaport. We've got members all over the seaport. So if it doesn't make sense for an individual company, for example, they could participate in something more group-based. The other thing I'm thinking about is I happen to be in an office building where I'm on half of a floor, and there's 20 floors in the building. So there may be some cooperative types of things in a building among multiple businesses, or one-on-one with a business that is big enough maybe to say, what, I want to do it. I do it on my own. Am I kind of understanding it?
No, you're absolutely right, Jim. One is, the shared site is the one that the situation Kevin described is obviously when you have multiple employers in a particular zip code, right? So in Cambridge, it's 02142 or whatever it is, right? All the people will come to a shared site. Clearly, rather than going geographically, if you go vertically, which you've done in your building, that's hard to do because people don't want to let hordes of people through their security systems, etc. But if you are within a large office block where everybody goes through the security system, then setting up a shared site that will serve a whole office building is something that we've talked about with various real estate vendors, and something that could be done quite easily. We just need a space which is large enough. The Kendall Square site, which is shared, which will do about 2,000 tests a week at peak, Was it 50 by 20, Kevin, or something? I can't remember what you said.
30 feet.
50 by 30.
Okay.
And you need specific traffic flows, Jim, because you want people to enter and leave through different entrances. So we just need a certain level of geography that we need to manage as we think about people flow through the system.
Yeah, and just to add to that really quickly. So I think, Jim, in an ideal world, I think if we can get, property managers, real estate developers to get on board and to really kind of support the mission, I think we would love to be able to set up a dedicated testing facility for an entire building, right? I think in our experience, those conversations just take longer. We have several of those ongoing, and we're hopeful that something will come out of that. I think, where we've been able to succeed with shared sites so far is just identifying early adopters, early real estate partners who have been kind of more forward thinking, and through their facilities, be able to set up these sites. And so absolutely, we'd be open to considering, in building, testing services for the entire building, especially in a large. It's just a matter of, whether those partners are willing to start thinking in this vein.
Okay. So putting my non-scientist hat on, as we think about the medical dimensions of this, we think about certainly the testing that you're talking about. We think about the treatment and advances in that. And we think about the ultimate vaccine, and, a lot of the timing depends on, I guess, who you listen to and all of that. But I guess my question is that maybe people have this perception that, as the advances in the treatment and the identification of a vaccine, move forward, this testing becomes less important. Validate or dispel that notion.
So I'll take that one, Kevin, right? So what I would say, Jim, is, how long will we need testing is sort of what you're asking, right?
Yeah, I guess.
I think we'll need testing. I'll send to you, or Kevin will send to you, a paper published by McKinsey last week, where they ran various scenarios where are looking at efficacy of the vaccine and the uptake of the vaccine. So if you have a 50 to 60% effective vaccine, and remember the FDA said they'll take everybody, I think about 50%, and you have a 30% uptake or a 40% uptake, then obviously it'll take a lot longer to get to herd immunity than if you have an 80% effective vaccine and 80% of people take it, right? So I think, and so I think we'll be testing into 21, definitely.
Yeah.
And I think importantly,
but I'll send you the paper, Jim. You can circulate it to your members.
Yeah, great.
Yeah, and just to build on what Moses was saying, I think with regards to uptake, there are so many factors that go into that. And the reality is, logistically, we as a country, and I don't think any nation has ever had to deal with this kind of mass distribution, mass manufacturing and mass distribution in such an acute time frame. And so I think the reality is it's just going to take time. Like even once the vaccine is able to go through the regulatory process and is able to get manufactured, to get that distributed, to get people vaccinated, and then at the numbers that we need in order to start to get community protection, it's just going to take time.
Try getting a high dose flu vaccine today, Jim.
So here's an interesting question. As employers consider rolling out a program like this, talk about the tactics for marketing it to the employees and the decisions around mandatory versus voluntary for those that might be, I don't know, a little skeptical or difficult. I don't know what the word is.
Skeptical is good. Kevin, do you want to take that? You've been dealing with that slightly more than I have.
So I would say that for a lot of employees, or for a lot of employers who have a fraction of their population that don't need to be at work, they're not coming into work, right? And the reality is a lot of people are adopting this new normal of remote working, and it's working out fine for most folks. The reality is, though, that there are a number of types of businesses where you have to be on site, right? Whether it be because, access to equipment or interfacing with customers, you have to be on site. And the reality is, what we've heard consistently is that for those employees that have to be on site, they're concerned about their health and they're concerned about their safety. And so compliance across the board, for compliance with kind of testing programs that have been offered, even on a voluntary basis by employers, has been very high, right? Upwards of 70, 80% in those populations that are back at work. I think in terms of kind of, the decision to either make the decision by the employer to make it either voluntary or mandatory, I think that ends up being a really nuanced one, where it's really about your risk appetite, right? I think on one extreme, if you want to be absolutely sure that you're completely minimizing the chances of any type of infection outbreak, then you want to make it mandatory. You want to make sure that everyone who's coming on site has a proof of negative test, right? That's definitely on the extreme, but I think that's the only way you can be the most certain, right? And I think we are seeing some people move in that direction. That being said, I think if you're also testing people frequently enough, it may not be necessary to make it mandatory. As long as you make it available, easy, convenient, which are all things that we strive to do. As long as people feel like they have access to it, maybe that is enough for certain employers. But I think it's really a matter of kind of your individual risk appetite.
Yeah. We can introduce your members to people who've gone through this, Jim, who've gone from voluntary to mandatory, so they can talk a bit about one-on-one how they came to that decision.
Okay, and just the goals for the program. What do you? I understand the purpose. I think the target kind of audience, but as you think about maybe what you want to achieve within this region, what's your big goal, hairy goals?
Well, so the overall goal is to become redundant, right? That's because if we become redundant, then we've achieved herd immunity in a way that we want. The second, I think, is to make testing widely available, especially to the use cases we talked about, Jim, such that we can get back to work. I mean, I think the more we stay at home, there is an economic cost to that. And there is people do need to see each other to work. I mean, I find that Zoom is great for tactical meetings, but every now and then you need to meet people to brainstorm and kick ideas around. So I think getting people back to as normal a life as possible in as short a time as possible is the short-term goal, and the long-term goal is to become redundant.
Okay. And the final questions that are in the queue that I have been saving for the end is what next? For people that are interested, certainly they can reach out to us and we can connect them with you, but what should they do?
I think if reaching out to you directly is one way. I think we have a website, Kevin, which is info@beacontesting.com you can go to. But reaching out, we would love to strengthen our relationship with you, Jim. So if they reach out to you and you can come, because I think having you involved in this will be helpful, because then you'll be able to share our experience with your membership in a way that makes sense. So reaching out through you or reaching out directly, both are absolutely fine.
Okay. Kevin, anything to add to that, or is that the?
I think so I don't know if it's easy for us to distribute the slides. I think we'd be happy to share those, Jim.
That'd be great.
Offline on how to get that out to members. And I think importantly on one of the last slides, we do have an email, info@beacontesting.com. Anyone and everyone is encouraged to email that or send an email to that account, and we'll try to respond in a timely manner. And again, reaching out through GBCC or directly to us, either way is perfectly fine.
Great. Kevin, Muzz, thank you so much for your time. Thank you for your focus on this effort. I think it is, as I said at the beginning, as I listen to the employers of Greater Boston, this issue of providing the safest and most comfortable return to work is foremost on their minds. and providing on-site testing is certainly a big step forward in that regard, particularly that meets that, relatively low cost, quick turnaround criteria that people have been waiting for. And as someone that has had that deep nasal test twice, I appreciate your bringing others as well. We will continue to make information about this program available, particularly as Project Beacon opens up shared testing sites in activity centers around Greater Boston to our employers. So stay tuned for more information about this. Before I close, I want to highlight we have more events coming up in the Chamber. Our Government Affairs Forum will next be on Thursday, October 22nd at 2 p.m., featuring United States Congresswoman Catherine Clark. This will be her first formal address to the Chamber of Commerce in this series. So as we focus on all of the activities going on at the federal government level, I'm sure Congresswoman Clark will make an interesting presentation. This event and many more that we're focused on, additional information is available on our website, bostonchamber.com. Once again, to our participants, thank you for joining us today, and to Muzz and Kevin, thanks for the great work and the great presentation. Muzz?
Thank you so much.
Okay.
We look forward to hearing from you. Bye-bye now.
Thank you. Bye-bye.